Dear student, today topic is postmortem report writing and sample preservation. Myself, Dr. Rajesh Joshiara from Forensic Medicine Department, BJ Medical College. In previous lecture, you have learned about the postmortem examination. So, in that lecture, you have learned about the various type of autopsy, the objective of the doing postmortem examination. But now we learn forward about the postmortem report writing. So one thing take in your mind that postmortem report is the medical legal report, and they have some prerequisite things to do. Then afterward all the procedure is done. So what is the basic things we should take in mind? Which type of postmortem report is we should do on our postmortem examination? What is the part of postmortem report? What things we should take particulate in that things? So move onward. First thing is that some general consideration regarding postmortem reports you should take in mind that you have to submit your report within 24 hours. Write in the good and readable handwriting. Don't use abbreviation or symbols. Do not keep blank any column. As far as use simple language, one copy of the postmortem report should be signed and sealed and given to the police. Other copy is for our personal purpose of medical legal record, and third one copy is, that is a second carbon copy, to be sent to the FSL if in the postmortem examination you have taken some samples that may be used for analysis of further reports. Okay, so before starting a postmortem examination, we should take this thing also in the mind that postmortem examination should be conducted only when there is an official order from the police or magistrate. So which document are required? So requisition letter, inquest panchnama, Maunotar form, and if person who have died have taken some medical treatment, so required treatment papers. And if you have conducted postmortem, that is a second autopsy, then you should have the first autopsy report, etc. Okay, so see, this is the specimen sample given for your understanding. The requisition letter. In requisition letter, they have investigating officer have mentioned to you for the particular person and their address and which kind of examination we have to done and which sample should be collected furthermore in that postmortem examination. So this is the requisition letter. Okay, then this is inquest panchnama. In inquest panchnama, there is two punches is present with the particular case and the dead body, and all the panchnama regarding where the dead body found, which type of implicated injuries present on the body, which ornament, which clothes present, all that things are particularly mentioned in the inquest panchnama, and that is duly signed by the punches and also the investigating officer. And third one is the Maunotar form. In that there is the summarize the all the investigation done. So the particular the person name, their age, when he was died probably, okay, what is the reason of the death, and all that thing, and duly signed by the investigating officer. Okay, so now move onward about the postmortem report writing. So the postmortem report is compiled of in the 5 part, that is one general particulars, then external examination, then internal examination. Afterward, on the conduction of postmortem examination, you have to preserve some sample if required by the police, and you have to opine about the cause of death. So in the general particular, we have to mention about the PM number, name and address of the deceased person who have done the postmortem examination, we have the sent the dead body, that name of investigating officer who have brought and identified the dead body, and ultimately you have to return about the time and date of receipt of dead body, beginning of postmortem examination, and completion of the postmortem examination. So this is a specimen sample, so in which you have to write down the deceased name, age, and all that things. See, in the column number 5, there is the substance of the accompanying the report from police officer or magistrate. So in that column you have to write down about the as per the police papers. And column number 6 is particularly mentioned if you have done postmortem examination at the scene of crime, not at the place of hospital. So you have to mention in that particular column, and if you have done the postmortem examination at your place, then you have to write not applicable. See, one thing, postmortem done by, so if you are doing the postmortem, then your name, your designation, and place of your designation where you have to design. Okay, so that all thing you have to write down. Okay, now move onward. Second part. In second part of the postmortem reports, there we have to mention about the external examination. So in that you have written in the column number 7 about the age, sex, race of the person, the body received, description of the cloth or ornament. If the condition of the cloth, there may be stain, there may be soiled, there may be torn, there may be sharply cut, everything all. So you have to write down all that thing in the external examination in the column number 7 and 8. Ultimately, in identified case, you have to mention about the dead body is identified, but if dead body is not identified, then you have to mention about the special mark of identification and the condition of hair and all, etc. Second thing, if you have faced to do postmortem examination of newborn child, then you have to mention furthermore things about the length of the newborn, head circumference, chest circumference, weight, the state of hair, nail and umbilical cord, etc. all that thing. And after that, in the external examination column number 10, one thing, dear student, take in mind, please bring your journal so you can understand all that things or particular column very better. Okay, so in column number 10 you have to describe about the built and nourishment of the dead body, and also the dead body is cold or warm. Okay, so see the description given in the PM report. I will read about small para so you can understand. This is the report of the unidentified dead body. So we have mentioned all that things that unidentified dead body of female aged about 25 years. Okay, received in white and red color chadar. Then the wearing that is the white color half sleeve kurta, red color bandhani design pajama, all that things. So describe the clothes weared on the dead body. Then we have described about the length of the ligature material. So this is the case of particular case of hanging. So all that ornaments or things present over the body, that all are mentioned. Also see one white metal earring present in the both ear lobule. So you have to mention all the clothes and ornament in the column 7 and 8. And in 9 particular you have to mention about the identification mark. Okay, then we have mentioned about the teeth. Okay, then in column number 10 we have mentioned that body is cold, moderately built and moderately nourished. Fine. Another description is given as mentioned in the previous. This is also the unidentified case, and all the ornaments are written. Then the tattoo mark, you see that the tattoo mark of snake is present over the lateral aspect of right arm and Virubai over the front aspect of right forearm. So all that things you have to mention, and just correlate with the requisition in English Panchnama, that all that things are also mentioned in English Panchnama and here also. Okay, now move onward. In the external examination, there is the page number 3, that is start from column number 11. So you have to mention about the rigor mortis. Why rigor mortis is useful for the time since death. Okay, so you have to mention about the rigor mortis are in the strong form, in developing form, or in the passing form. Ultimately, in column number 12 of external examination, you have to describe about the postmortem lividity. So you have to describe about the color, sight, nature, and sign of decomposition if present. Okay, so that all are thing is different by particular and particular cases. Okay, then in the column number 13, you have to describe about the face, as in the Gujarati PM note is described as sabna chehrano dekhav. Okay, so you have to describe in that face is the natural, swollen or identifiable, condition of the eye, is there open, closed, semi-open, conjunctiva, is there congested, pale या hemorrhagic, about the cornea, that is the clear or hazy, pupil, that may be constricted or dilated. So all things which you have do on the examination and which thing you have find, then all that things you have to describe in the postmortem reports. Like that, tongue are protruded or within the oral cavity, or if any spillage of fluid from the nostril, mouth or ear, then you should have to write down. So see the specimen sample, that in the column number 11, that is shown that rigor mortis is present all over the body and strong in form. So you have to describe where is the present and which in the form. Then in the column number 12, that is the faint postmortem lividity is present over the front aspect of the chest, lateral aspect of the right side of the chest, abdomen. Okay, and then ultimately lastly is shown as, that is the fixed. What mean by the fixed? If postmortem lividity fixed, then time since death is about then more than 12 hours. Okay, so these both column, rigor mortis and postmortem lividity, are useful for the time since death. Then in the column number 13, we have described about the facial features. Facial features are distorted and become identifiable. Okay, then we have mentioned about the eyeball. Okay, then we have mentioned about the cornea, that is a hazy, pupil are not seen, conjunctiva pale. Okay, soft tissue surrounding the both eyes show the extravasation of the blood. So all that things you have to mention. Very fine. Then in the postmortem report, page number 4, there is a describe about the injury pertaining to the external genital or purging. So you have to mention about that and the position of the limb. Now move onward. In the postmortem reports, in the second part of the external examination, that there is the column number 17. That is very most IMP column. Why? Because all the injury present over the body are mentioned in the column number 17. We go thoroughly and I give total overview about the common cases or common type of injury. So if you faced the postmortem examination of the assault case and you found the mechanical injury, then what thing you should take in your mind? So you have to describe the type, size, situation, direction, age, and color changes or healing process, surrounding area, foreign body, all that things which are useful to identify the particular injury. So simply we go onward. If you find the abrasion, then what thing you should write down? So you have to write down the type. The type is the scratch abrasion. Then the size 21 by 0.4 centimeter. Then color, that is the red in color, present over where side? So where is the front and outer aspect of the left side of the chest. Then you have to describe the specific landmark. That inner end is 17 centimeter below to the left upper and 14 centimeter left to the midline, while outer end is 31 centimeter left to the midline and 4 centimeter below the lateral to left nipple. So you you have to write down the type, size, color, site, specific direction, and all that things. If you found on the dead body that laceration and abrasion, then how to describe the laceration? I give just overview. Then after onward lectures, we should do exercise to how to write down the postmortem reports of the mechanical injuries and all that things about the hanging, about the burns, about the asphyxial death, about the firearm. But in this lecture, I give just a overview. That's why you can understand things betterly. Okay. So, if you want to describe the lacerated wound, then see number 4, the lacerated wound of the size 4 by 0.5 centimeter to 1 centimeter. Then the direction, that is a horizontal present just above the right eye, over the right eye eyebrow, 2 centimeter right to the midline. Then you have to describe about the margin, because this is a lacerated wound. So margin of the wound are pale. On internal examination, the underlying frontal bone is fractured. So one thing is take in mind. If you describing the injury, then in the correspondence area the internal injury is present, then all the injury you should describe in the column number 17. So the consequences is the best understand. Okay, like that. If you describe about the lacerated wound only, then you have to describe like lacerated wound of size 6 by 0.5 centimeter present vertically over the left side of the forehead, 1 centimeter above the left eyebrow, and 2.5 centimeter left to the midline. Margin are abraded and contused. Underlying soft tissue show the extravasation of the blood. Dark red in color. Underlying skull bone show the depressed fracture. So when you describe the injury, you have to mention all that things, so your injury can be justified. Okay. Now there, move onward. So up to this we have learned about the external examination in the postmortem reports, that is compilation from column number 7 to column number 19. Okay, and after that the third part is internal examination. So internal examination is started from the head, cranial cavity. So in case of internal injury is present, then you have to describe if the injury is present at the scalp, if the injury is happens to the skull bone and fracture is seen, then the brain matters. So all that column you have to mention in particular cases. You have just like that in the injury of the scalp. So in this specimen sample, you have given the inner layer of the scalp at left frontoparietal region show the extravasation of the blood. Dark red in color in the area of the 10 by 8 centimeter. This injury is consistent with the injury number 1 mentioned in the column number 17. What is this? You have already described external injury in the column number 17, and on internal examination you found the injury that is corresponding with that injury. So you have to mention like that. Then in the B column, skull vault and base. So depressed fracture of size 5 by 4 centimeter present over the left side of the frontal bone. Fracture bone is converted into the pieces which are driven inward. Underlying dura is the torn. Okay, so what is the thing? Depressed fracture happen, and then beneath the skull bone there is a dura mater that is also torn. So all that things you have to describe concisely. Then there is the column number 22, that is the thoracic cavity. So you have to describe about the chest region, that is the wall and rib and cartilage. What is the condition of the pleura, larynx, trachea and bronchi? What is the condition of the mucosa? Okay, right and left lung, pericardium. Okay, so pericardium and heart and its weight and additional remarks. So all that things are start in the internal examination. Okay, now we give some overview about internal injury specifically in the cut throat with the stab injury. So how to describe it? So you can describe like that. See in column number 17, one cut throat deep incised wound of size 14 by 5 centimeter in length, maximum width in midline is 4 centimeter. Then see the direction horizontal, present over the front of the neck, 9 centimeter below the tip of the chin in extended position of the neck. So when you describe the injury, you should mention all the things, okay, like that. If you have done the postmortem examination of the cut throat with stab, then how do you do, or how do you opine the cause of death, concisely opine the cause of death? So see, opinion about the cause of death is given as died due to shock and hemorrhage on account of injury to the neck and abdomen caused by sharp and penetrating object. Okay, this is the another example of stab wound. Description is given. This is also the internal stab wound description, but we should learn about all that typical injury by one lecture. Okay, now I want to give some superficial idea about the firearm injury. If you have to do postmortem examination of firearm injury, then what things you should take in your mind? So number of firearm entry wound and exit wound, size, shape, situation, age. In case of entry wound, you have to see the abrasion color, graze color, burning, blackening, tattooing, or any blast effect. In some case where if fire injuries happen due to the shotgun or country made gun, then the dispersal of pellet you should have to mention. Direction of the track, okay. If found bullet or pellet like foreign bodies, so you have to mention all that things. And color of the subcutaneous tissue and muscles on the track of entry and exit wound. Okay, so this is the description given. I want to explain only the firearm entry wound. Okay, so how to compile the injury of entry wound? So you have to describe like firearm entry wound of 0.5 centimeter in diameter, round in shape, present at outer and posterior aspect of the left arm, 11 centimeter below to the left shoulder tip, and 65 centimeter above from tip of the left middle finger. This wound is 33 centimeter below from the top of the head and 134 centimeter above the left heel. Abrasion color of the thickness varying from 0.2 to 0.4 centimeter present around the wound, which is more at upper and outer side of the wound. Blackening, black tattooing present around the wound in the 2 to 4 centimeter area, which is more in upper and outer side of the wound. Then we have described the track of bullet. So track of bullet is established from entry wound to posterior aspect of the upper part of the left humerus bone. Okay, then the margin of the wound, that is the inverted, then the fresh clotted blood is present. Okay, so you have to describe all that things like that. If you have open about the cause of death in firearm, so that may be like the died due to shock and hemorrhage on account of firearm injury to the body. Now in firearm case, you have to take a sample the skin and soft tissue of the entry wound, skin and soft tissue of the exit wound, control sample, blood sample. Okay, all that are taken for the forensic ballistic examination. Okay, like that. In case of asphyxia due to hanging, due to strangulation, then what things you should take in mind about the material? So nature of the material, position, type of knot, circumference of the loop, length of short and long free end, if any foreign body is present or any stain, and particular. So this is the about the ligature material only. But due to ligature material, which kind of ligature markings happens to the neck? Okay, so the position, the nature, the direction, extent, whether that is a complete or incomplete ligature mark. Okay, then other thing, ligature mark is situated in relation to the chin, ear, and external occipital protuberance. Okay, then you have to mention about the salivary dribbling. It may be present in their particular position, extent, or direction. Okay, then you have to describe about the neck structure, hide bone, thyroid cartilage, tracheal ring. Okay, so you have to dissect and see the neck structure and find out about the extravasation of the blood, contusion or bruise, or any fracture is present or not. Okay, see the simple description is given, so all that things we have discussed, that is written in this injury in the column number 17, like that. Ligature mark in the form of brownish parchment like abrasion, obliquely present over front and lateral side of the upper part of neck, above the thyroid cartilage, incompletely encircling the neck and forming inverted V shape over occipital region with, because this is the incomplete ligature mark, so we have mentioned about the gap, with the gap of 8 centimeter over back of occipital region. So this is describe the ligature mark. Then now the direction of the ligature mark. So direction of ligature mark is obliquely upward, backward, and posteriorly. Then we have described the dimension. The total length of the ligature mark is 27 centimeter. Width is varying from 1.5 to 3.5 centimeter in extended position of the neck. Okay. Upper margin of the ligature mark is 4 centimeter below the chin in the midline, 1 centimeter below right angle of mandible. Okay, 1 centimeter below left angle of mandible. Okay, so these are all dimension is mentioned, and after that we have dissect the internal neck structure. So on internal examination of the neck, underlying soft tissue, muscles and cartilage and bone showing no injury, and underlying soft tissue are pale and glistening. Okay, so if we conclude about the cause of death in case of hanging, then there may be written like died due to asphyxia on account of hanging, and for further investigation viscera is preserved for chemical analysis. Why? If police says requisite that but the person is died due to hanging, but they may take some drugs or some substance. Okay, so in that case, if police ask for the sample, then we have to take on the all the samples regarding. Now if police have suspicion of sexual assault, then they may ask for the swab, vaginal swab or slide. Okay, so we have to take all the sample that required by the police. So in cause of death we have to mention the cause of death and the which type of sample we have taken. Okay, like that, this is the cause of death mentioned in case of throttling. Now the common cases come in our Gujarat, in particular in the Ahmedabad, about the burns. So what's thing we can take in mind about the burns? So you have to know about the nature of the burns, whether that is antemortem or postmortem, fatal changes that may be happens to the area of the burns. Okay, the extent and degree of the burns present over the body, condition of the hair, that may be singeing or blackening, body part, condition of the body part and clothes, that also you have to mention, presence of soot particle in the trachea and air passages. Okay, then smell of kerosene like or other inflammable substance. So all that things take in mind while you are doing the postmortem examination of the cases of the burns. Okay, there is a simple description is given in the column number 17, like degree. So that is a dermoepidermal burns present over where? So whole body except over both feet and both axilla. Sooty blackening effect due to burns present over the body at places. Peeling of the epidermis due to the burns present over the body at places. Exposing area, see, that is a vital reaction. Exposing area is a red and inflamed. Red line of demarcation is present. Okay, blister formation is also present. Okay, where? So that is the present between the junction of the burnt and unburnt area. Okay, then all body hair are singed, heat rupture is also present. Then in the column number 18, there is no external palpated fracture is found. So all that things are mentioned. See, in the column number 19, that mentioned that above mentioned burns are antemortem in nature. So you have to describe in case of injury or burns, rather that is antemortem or postmortem. Okay. See, this is the example of the burns. Then what kind of internal finding may be seen? So I want to show the column number 22. C, larynx, trachea and bronchi. What is this? Okay. See, there is the mucus is congested, and on internal examination they are found carbon soot particle mixed with mucus is present in the larynx, trachea and bronchi. Okay. So you have to mention like that in burns cases. And if we conclude about the cause of death, then there may be like died due to shock on account of burns, and further investigation viscera is preserved and for chemical analysis. Okay. Now, particularly very common case of poisoning is found. Then there, if poison is ingested, taken by oral route, then GIT finding are seen. So we see in the stomach. See, in the stomach, and it contains about 5 cc creamish brown liquid material, submucosal hemorrhage present over the greater curvature. Acha, smelling is the irritant, unusual and non-specific. Okay, rest nothing particular. So you have to mention all the effect due to any weapons, due to any drugs, due to any substance, uh, in compilation in the postmortem reports. Okay, this is the cause of death is given. Now the most thing is, when we do postmortem examination, then we should take all that thing is the mind, like thoroughly reading of the inquest panchnama, then we do external examination, then do internal examination. During the process of examination, we have to collect some samples. Okay, so common samples. If in case of suspected poisoning, then you have to collect the samples like that in the bottle 1 stomach, and it contains with its preservative. Bottle 2, that is a pieces of liver, each half of kidney and piece of spleen, then blood. Okay, then sample of preservation that is used to preserve the above 1 2 3 bottles. Okay, so this is the common sample should be taken. And one thing is take in your mind, this is your viva question also. A common preservative is the saturated solution of common salt, but in case of acid poisoning, suspected acid poisoning, then rectified spirit may be used. Okay, and second thing is take in mind, if you collect the viscera, and the sample is sent for chemical analysis, then the container that is the characteristic of container, that is a mouth-held glass bottle of about the 1 liter capacity. You should fill up to the 2/3 capacity. All the container are appropriately labeled and sealed. Okay, so all that things you should take in mind, and where you have to describe that all things. So that is described after internal examination is completed. The sample preservation, there is a particular column is given in our postmortem report writing. So you have to describe all the sample you have taken and for which you have taken. Okay, now this is some different sample collection, like firearm injury. Then firearm injury, you have to collect the blood for blood grouping and cross matching. You have to collect the pieces of the skin and subcutaneous tissue of entry wound and exit wound and control wound. And if you found a foreign body like bullets or pellets or anything, so you have to collect that for forensic ballistic examination. Okay, now move onward. In some cases there are no any external injury found, there is no any suspicion of the poisoning and all that thing. but person who has died due to the some pathological cause or morbid condition or some disease conditions. So in that case you have to collect the tissues for histopathological examination. So one thing is take in your mind, in collection of histopathology you should use preservative is 10% formalin. Commonly we collect all dissected heart, piece of vein, each of lung, liver, spleen, kidney or uterus, all are in the pieces. But in some, according to pathology, some cases we should with collect like esophagus, stomach, prostate, pancreas, where the pathological condition is found. So you have to collect that particular organ for the histopathological examination. Okay. Blood. So if blood is taken for blood grouping cross matching, then we can simply cotton piece soak in the blood and air dry, and that may be taken for the sample. Sometimes we have to take swab and blood sample for the microbiological examination. Okay. So sometime hair in case of assault. Okay. In case of specifically in case of sexual assault, then we have to collect above the pubic hair. Okay. Then sometime in the sexual assault we have to collect swab. So there may be vaginal swab, deep vaginal swab, cervical swab, anal swab, oral swab. So all swab are taken, and they are rest for air dry and then seal and label. Okay. And one more thing, sometime dead body is taken for postmortem examination, and personal clothes, bed sheet, bed cover, pillow, or anything, weapons, all that things may be sent with body or found beside the body. So we have to collect all that things and mention properly and label and hand it over to police for further examination. Okay. uh, this is not for you. Now last but the least, commonly what happens, sometime we found a dead body that is a decomposed. Then what thing we should take in mind? So in the decomposition, that is seen by external examination. So we have to mention all the things in the column number 12. Okay. So like that dead body is in state of decomposition, emitting foul smell. Postmortem lividity cannot be appreciated due to decomposition. Greenish discoloration, marbling, peeling of the epidermis, and blister of the decomposition present all over the body at places. Deglowing and restocking present at abdomen and external genitals are distended due to the accumulation of the gases. Maggots of the size 0.5 to 1 centimeter crawling all over the body. So the decomposition sign, all that found, that should be mentioned in column number 12 of the postmortem reports. Okay. And this is another example of the decomposition sign. So thank you. We have learned about the various topic in the simple overview, but later on lectures we should learn about the particular case in the particular things, and we should do autopsy report writing by the case wise case. Okay. Thank you very much.